It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I showed you how to give yourself permission to have peace of mind, control, power, and influence when your loved one is critically ill in intensive care. You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to share with you how to deal with a difficult intensive care team when your loved one is critically ill in intensive care. Having a loved one critically ill in intensive care is nothing short of being a once-in-a-lifetime challenge and a once-in-a-lifetime experience. Peace of mind, control, power, and influence are not words, feelings, or realities you can easily associate with when your loved one is critically ill in intensive care. If anything, fear, frustration, anxiety, stress, overwhelm, sleepless nights, being way outside of your comfort zone, and vulnerability are the words, feelings, challenges, and realities you are dealing with. And if you are like 99% of families of critically ill patients in intensive care who have no peace of mind, no control, no power, and no influence, you are extremely passive. You watch and you witness an event that leaves you paralyzed. But if you want to have peace of mind, control, power, and influence, you need to proactively seeking a way out of the dilemma. Most families of critically ill patients in intensive care have no peace of mind, no control, no power, and no influence. Most families of critically ill patients in intensive care don't make up their own mind. And most families of critically ill patients in intensive care have no idea what to do if their loved one is either very unstable and in a very critical condition, or if their loved one is in a life-threatening situation, or if their loved one is in intensive care for long-term treatments and long-term stays, or their loved one may be having a severe or traumatic head or brain injury, or their loved one may be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order. Or their loved one may be in a situation where the intensive care team suggests a withdrawal of treatment or a limitation of treatment as being in the best interest of your critically ill loved one. Or your loved one may even be approaching their end of life in intensive care. Those are also the situations where you and your family are at a total loss what to do, and if you want to get a handle on things quickly, you will actually need to step outside of your comfort zone and also deal with and manage the intensive care team. Keep in mind that you are way outside of your comfort zone already, but you just need to use being outside of your comfort zone to your advantage by challenging the intensive care team. After more than 15 years intensive care nursing in 3 different countries, where I have literally worked with thousands of critically ill patients and their families, I have seen over and over again that you actually do need to step outside of your comfort zone in order to have peace of mind, have power, have control, and have influence. And you may, in the process, also ruffle some feathers with the intensive care team. And rightly so. Keep in mind, I'm not talking to you if your loved one is a straightforward ICU admission and will be out of ICU in a couple of days or so. I'm talking to you because your critically ill loved one is either very unstable and in a very critical condition, or is in a life-threatening situation, or is in intensive care for long-term treatments and long-term stays, or is having a severe or traumatic head or brain injury, or is threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order, or is in a situation where the intensive care team is suggesting a withdrawal of treatment or a limitation of treatment as being, quote unquote, in the best interest of your critically ill loved one, or your loved one may even be approaching their end of life in intensive care. I also need to get a couple of things straight here. You will meet some wonderful people in intensive care, doctors and nurses. However, if your loved one is critically ill in intensive care and is in one of the aforementioned challenging and difficult situations, you can't afford to not have peace of mind, control, power and influence. And during the aforementioned challenging, difficult and often heartbreaking situations, you will be hearing things from the intensive care team that leave you even more challenged. Keep in mind, the intensive care team knows what to say and how to say it. You may or may not be able to direct the care and treatment of your critically ill loved one. However, you need to make sure that you give it your best shot, because the things that are happening in intensive care behind the scenes are so powerful that they almost always impact on how the intensive care team positions your critically ill loved one's prognosis and diagnosis. And if you stand out from the crowd, if you start doing your own research, if you start asking the right questions, if you even start asking difficult questions, the intensive care team may well perceive you as difficult and demanding. The number of times I have seen and heard intensive care teams refer to families of critically ill patients as being difficult or demanding in their handovers is rather concerning. It usually happens when families in intensive care start doing their own research, when families dare to look behind the scenes in intensive care, when they are extremely and genuinely concerned about their loved one's best interest, and when they dare to challenge the intensive care team's assumptions. It also goes to show that there's a lot at stake in intensive care that goes way beyond your critically ill loved one's diagnosis and prognosis. It also goes to show that the culture in an intensive care unit is something you and your family need to observe carefully, and you need to get a feeling and an idea whether you are dealing with a positive or a negative culture in an intensive care unit. A positive culture in an intensive care unit makes a huge difference to patients, their families and the staff. Even in those challenging and difficult situations that I mentioned before. You most likely will be treated with courtesy, and you most likely will be treated with respect, and your opinions are taken into consideration. Most intensive care units that I worked in, however, have a negative culture, and politics, dynamics, power play and power struggles, hierarchy, competition for limited resources, the dynamics, the intrigue and the psychology at play have a huge impact how the intensive care team is dealing with you, your family and your critically ill loved one. However, you also need to know that if you think that the intensive care team refers to you as being difficult and demanding in their handovers, you should be taking it as a compliment. Again, 99% of families of critically ill patients in intensive care who have no peace of mind, no power, no control and no influence have long given up. They put the intensive care team on a pedestal. They suck up to the intensive care team. They don't rock the boat, and they are oblivious to the fact that the financial interests and the financial budget of the intensive care unit, the bed management pressures in intensive care with numerous other critically ill patients awaiting a precious, scarce, expensive and in-demand intensive care bed, and the medical research interests of an intensive care unit. Medical research attracts multi-million-dollar per year funding into intensive care units and is often a positioning tool for ICUs. Those are the things that are almost always playing a huge role in how the intensive care team positions your critically ill loved one's diagnosis and prognosis. Therefore, if the intensive care team paints a doom and gloom and negative picture, you and your family need to be on high alert. If the intensive care team is not being open and transparent, and if the intensive care team keeps you at arm's length, you need to move heaven and earth, so to speak, to get to the truth of the matter quickly. Your job is to have peace of mind, control, power and influence, no matter what. Even if your critically ill loved one is inevitably dying or approaching their end of life, you need to make sure that the intensive care team is telling you the truth so that you and your family are not taken for a ride. For example, the intensive care team might want to sell you on a withdrawal or limitation of treatment as being, quote unquote, in the best interest of your critically ill loved one, because they desperately need the ICU bed for the next patient, or they think they are not meeting their budget targets when continuing treatment for your critically ill loved one. Or even worse, if your loved one is really critically ill and the intensive care team can't enroll your critically ill loved one in a medical research study, and they therefore want to reallocate their resources towards other, more interesting patients who qualify for medical research that attracts more funding. The bottom line is that if you even have the slightest doubt that the intensive care team is difficult to deal with, you mustn't retreat, and if anything, you need to keep pushing until you have peace of mind, control, power and influence, to the point where you know that your critically ill loved one is getting fair, equitable and just treatment that is not dependent on what's happening behind the scenes in intensive care. So, how can you deal with a difficult intensive care team and quickly get peace of mind, control, power and influence while your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section where we answer your questions, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you in another update next week.